Manguvhewa. Okay, thanks so much. So Mutshinye is a registered counsellor. Also, she did master's by research, is it?
Yes, I did by research.
Yeah, by research, okay. So I think there's a discussion for another day. What is a master's by research? But today we are focusing on, what do you really do as a registered counsellor? So in the other video, I said that where I come from, the counsellor that I know is the counsellor for a political party. Do you have counsellors where you come from?
Yes, we do. It's like every village, every.
Thank you. Yeah. So I think it's important that we clarify that this counsellor we're talking about is not one for political party, but so we also have registered counsellors. So Mutshinye is one of them. She's going to explain to us how did she become and what it takes to being one. So what do they really do when they can see, what do they really do when they say they're waking up or they're going to work? Or if they say they are doing registered counsellor work, and then how long, how do they train, and what are they being taught during the training? And then you need to know also that there is a practicum that is involved. So that is the main difference between psychology honors and the B-Psych. Is the same NTF level 8. Is it? B-Psych is level 8. The 4-year one. Yes. So the qualification is there the same, is it the correct word? Same footing with honors according to National Qualification Framework. So it's level 8. So if you have a B-Psych program and honors program, there's a difference, which is going to explain to us. But to start with, what do you really do when you say you are practicing as a registered counsellor, also in comparison to clinical and counseling psychologists?
Okay, so for me, what I'm doing, I'm practicing in private practice as a mental health counselor. So to break that down is that we are guided by scope of practice of a registered counselor, like what you are expected to do. Maybe to put it in a way that can be more clear to other people, it's more like a nurse and a doctor, a nurse and a GP, a general practitioner kind of a setting when we are comparing registered counselor and other professions in psychology like clinical or counseling psychology. So the main thing that we do as registered counselor is to promote mental health. Besides promoting mental health, we do screening of psychological conditions. So by screening, we don't confirm conditions of people like psychological conditions, but we screen on the symptoms that the person is presenting with. And then from there, if we see there is a need, if symptoms are severe and they need to be managed further, it's then that we work as a multidisciplinary team with other professionals like a counseling psychologist or a clinical psychologist or a GP if the person needs to be hospitalized, or a psychiatrist. So apart from that as well, creating awareness, psychological education, which is, I think, is the base of what we do more. By psychological education is educating people about psychology, educating people about certain conditions, about psychology, preventative measures on things such as depression and anxiety. And also the other thing that we do is to contain symptoms, containing symptoms in a sense where maybe a person have gone through a traumatic incident, and we become the first-hand people to interact on a professional level with the person. Obviously, there'll be a lot of emotions that the person will be presenting with. We need to contain them. We need to provide supportive counseling. If there is a certain concept that they need to understand around what they're presenting with as well, we need to elaborate that to them, make them understand, which is the part that involves psycho-education. So where I'm now working, what I do mainly is to screen individuals, see if they have psychological conditions and refer them. Apart from that, what I do is that we check how people are coping with challenges that they're faced with. For an example, a person that is diagnosed with depression, We have levels on depression. We have skills that we use where we are able to cluster if symptoms are severe, if the person needs to go see the doctor, and if there is a need for that, immediately we need to communicate or liaise with the doctors for further intervention. And also another main thing is to check coping mechanisms that the person is using in the situation that they're faced with. And yes, apart from that, in my own private practice, I do counseling as broad, but I think I elaborated more with what I do at work and my full-time job. Yes.
Okay, thank you. So yeah, almost like first aiders in the field of, like, you provide first aid, but actually maybe more than that, because like what you mentioned, that you try to prevent the psychological, I'll use the word dysfunctioning. So you try to avoid that happening. And you mentioned the word screening. Excuse me, what's that? I'm scared now to visit you guys. What is screening?
So when we screen, you are checking for symptoms. You are checking for possible symptoms that the person is presenting with. So we have two ways that we use to screen a person. It's either you can screen somebody by asking them certain questions that are aligned to one of the book that we use, the Bible for psychology. DSM-5. Yes, so DSM-5 will stipulate to you that a person that is presenting with these symptoms will have this, and that, and also the symptoms must be present for this period of time. So when we screen, it's like we're using that manual of diagnosis, but just to check, is this person having the symptoms that are aligned to depression? And please do note that when we say screening, is checking. Like when we say screening, not necessarily to diagnose, because there is a difference in that. So by screening, maybe a person can say, I'll give an example with two conditions, depression and post-traumatic stress disorder. Like with post-traumatic stress, you find a person has been exposed to a certain condition and a traumatic incident. And then, so with that, when a person comes and starts telling you the symptoms, already we have an idea at the back of our mind that this might be a possible symptoms that the person is presenting with. But we now need to be sure of those symptoms. And when we reach that point of seeing the symptoms through asking questions or using screening tools for depression or anxiety, is then that we state that this person is presenting with symptoms of depression, and then it need to be confirmed further by either a GP, a psychiatrist, or a clinical psychologist, or a counseling psychologist.
Mention that, so if I speak to my neighbor, what is the difference? What is it? Why is it important to get such kind of training instead of you mentioned, okay, I go to my neighbor over the fence, I am experiencing this, how can I cope? So why is it important if you can tell someone who's watching want to become 4 years, the process that you went through? Other institutions, they offer that it takes 4 years, so that's a BPsych degree, 4 years. Why is it important in comparison to not doing it? So like, for example, I can just speak to you in trying to help you cope with the problem. And also, we can answer, you are registered, is it with the health professional transfer? What are the advantages of being registered in comparison?
Okay, so in psychology, you can study psychology maybe for 4 years, right? But after studying psychology for 4 years, if you have done your BPsych, it doesn't mean you are a registered counselor because you've done psychology. You also need to undergo through the process of registration with HPCSA, which will include writing their board examination. If you pass them, the board examination, you at least need to obtain above 70%. And after that, you are given like a practicing license, kind of, to show that you are now confirmed as a registered counselor, so you can start seeing people. So it doesn't only end with going to the university, but also registering with our board, which is Healthcare Professional Council of South Africa. And to answer the question that you posed about why can't I just go to my neighbor or a friend that I know that can do that, the most important, it's a good thing that people can have support network or support structures around them where they feel overwhelmed, they can be able to talk to them. But also seeking a psychological intervention on a professional level, it's very important. Looking at a number of things. If you go to a professional, we abide by ethics. I think one of the things that are most important in all these ethics is confidentiality, which we respect highly in psychology. Because imagine going to a neighbor and you talk to the neighbor about what you're presenting with, and then the next thing you hear what you said from somebody else telling you, I had this. Obviously, you feel very hurt. So confidentiality and other ethics that are in relation to practicing in a space of psychology are very important, and is the last thing that you need when you have a problem to also face other challenges of coming out. And also you need to come out in a safe space in a person that is trained to take what you are presenting with, be able to also not listening and talking, it's part of healing. But what is also more important is what is the treatment plan further? Besides just listening and being heard, is this person going to assist you with what you're faced with? Like in psychology, what we'll say, or in my space of practicing, there'll be a lot of psychoeducation that goes around that. And also to check how are you coping with the symptoms, because a lot of people tend to be subjected to other negative coping mechanisms when they are faced with challenges like drinking alcohol, engaging on certain habits that at the end of the day, they don't feel proud of. So it's important that as part of seeing, or when you have a challenge, when you're trying to get the assistance, you do it in a professional space. But in that professional space, also don't move away from having those few people that are closer to you, people that you can from time to time interact with. It's similar, but we do it in different level. Obviously, professional will do it in a professional level. A friend will be able to confront you from a point of a friend, not a professional. Yes.
Okay. So at your practice, do you charge people?
Yes, I do. I do charge people. I have pro bono services that I do where in cases where you know that there is a high need for psychological intervention and the person cannot afford, then I do pro bono services. But apart from that, I do have rates, and the medical aids, also medical aid rates, we are guided to say when you're a registered counsellor, this has how much you charge, and also depending on which medical aid are you charging from, like GEMS, Bonitas, Fed Health, and all of that. So they also release guides each and every year to be able to educate us through how we bill people, yes, or how we charge people.
Can you please tell us the average cost, just please, for how much does it cost? An hour.
An hour, I'll say 600. That is an average. There are medical aids that will even give you more than that. But for an hour, I'll just say 600.
For that information. But and also I think the second from last question, what is your advice to someone who's watching? Maybe the person wants to become a registered counsellor, and what are the characteristics, personality, or the attributes? Like we're jokingly saying before this recording that am I dressing appropriately? And then we're talking about it's important the way that you dress. And I understand that because I'm in the field. So what is your advice to someone who wants to become it? Someone grade 12, someone who is doing psychology already, or someone doing sociology? I have students who are doing a social work, but they want to move into psychology. So what is your advice?
Okay. Foremost is that you need to have a certain personality that aligns to psychology, or certain characters that aligns to that. For an example, if you are a warm person interested in getting to interact with people, it's a very good field for you to obtain the professional skills to go through the process to be in psychology field, because that will also be aligning with some of the characters that you have as a person. I'll give an example with this. Maybe for a person that will say, you know, I love being in a court space. I think I can be good with being in a court space, having to represent somebody and all of that, right? And funny enough, we do see these skills when we are growing, but sometimes we tend to move away from them. Like, you know, when you're in a group setting, you have that person that have something similar to that person that will always stand up for other people and say certain things. So those are some of the things that you can check as an individual to see, do I have something that aligns to this profession? And if you feel you have something that aligns to, or characters that aligns to psychology, which will be mainly to be there for other people, being warm so that people can be able to find you approachable enough to communicate with you, because that is very important.
So maybe that's why we have few males in the field. Because we are mentioning warm, okay, I'm not saying males are not warm, but anyway. So what else? So you must be warm enough, your character, and what else?
And also being able to relate with people. We all come from different backgrounds, right? And with other people, they find they have specific people that they tend to find easy to relate with based on where they come from or their background settings. But if you are or intending to study psychology, it's also important that you tend to be a person that is relatable with people coming from different backgrounds and different environment kind of living, because in the field you get exposed to a lot of things and you get exposed to people that are very unique and very different. Are you accommodative enough? Are you able to bring yourself to that level where a person will find you to be relatable and be able to communicate with you? I think that is very, very important. And also these are the characters that they check when they want to, when you are to get in the program. Yes, because you don't just apply and they say your marks are good and then you are in. There is still a process that happens before they can take students in their first year. Most institutions now are doing psychometric assessments, and also some of institutions are doing combining psychometric assessments and also interviews when they get to know you. Like, that's where they check most of these characters or skills, that do you have what it takes to be in the training? Not that you need to be like that in the beginning, but at least you should have what it takes to be trained to become or to be in the field of psychology. And when you're in the field, you learn quite a lot of things, from dressing, how you present yourself, how you communicate with people. So it's quite a lot in the journey, and it's not as easy as people would think. You learn a lot, you do research. Sometimes you get to know other cases that you feel when you move out of that room, you're like, God, you know, those are some of the things. But good enough, we also have practicums that train people on, beside the theory that you have. On your 4th level, you spend 6 months in your site of training, either be a hospital, be an institution, but you should be having supervisors there, like a psychologist or a clinical or a counseling psychologist. And then they get to sit even in some of your sessions when you are starting, like you counsel someone when there is another professional that have been in the field for a long, that guides you through the skills. So by the time you are done, you are in a space where you feel confident with what you've learned, and you have read it and also practiced it. So my last advice to a person that wants to study psychology is that first, to be able to know different fields that are in psychology. You don't, after your 4 years, you don't become a psychologist. Like with me, I'm not a psychologist, I'm a registered counselor, but I've studied psychology. Sometimes people find it to be very difficult to understand that. So explore the fields of psychology before when you are still on your first year, so that you'll be knowing, where do I want to be after completing 4 years? I want to be a registered counselor. I want to explore further into specializing in other fields.
I think something wrong with network there, but I'll fix it at the end.
Okay.
So are you also that you're comfortable giving us your details, and maybe someone want to the service. But yeah, anyway, I think we're going to have a flyer for you at the end of this video. People can watch. So people are free to call you. Don't call for other things, guys, please. If you have questions, if you ask me, don't if you want the service, yes, but if there's anything final, someone who's watching who's about to give up, someone who was about to give up, know this psychology. I've heard a lot of stories saying that they close for us, they don't want to become psychologists and all those things, and people quit, they change whatever they wanted to become. So what is your advice to someone who is about to give up, when maybe they want to become
Okay.
counselor or maybe a psychologist?
First, being passionate about, yes. So being passionate about something also means that you need to work hard for what you want. Same applies to getting through into psychology. It's quite difficult for some or number of people, but prepare yourself mentally and be reflective on yourself. When I say prepare yourself mentally, you should also familiarize yourself with some of the challenges that are in the field. Ask yourself if it's something that you can be able to bear enough. Apart from that, be reflective on yourself. Be reflective on what you have been through, who you are as an individual, and ask yourself if you do have what it takes from everything that you have been through in life. And I think that is the most important thing. If you like something, if you feel you're passionate about something, it will not gonna be easy for you to just have it on the silver plate, but you need to work on it. And also, if you're still studying or if you're in the field of psychology, have friends that are in the field. That is very important because it becomes easy. They tend to be more of your mentor. Have friends that are in the field, have other students that if you're still studying, have senior students that have done or that have gone through what you are going through, and talk to other people. It can be frustrating at times, but talk to other people, be open about challenges that you're experiencing, more especially as a student. Talk to them. Don't contain emotions because you now look like you're not strong enough to be in the program, or you are not strong enough to study psychology. Be open, talk about what you go through, talk about some of the difficulties that you're experiencing. You'll be amazed on the support that you will receive and the relief that you'll get from people that are already senioring you on the field.
Okay, thank you. So being reflective is about thinking what you're thinking about.
Yes, sometimes we tend to...
No, I don't want that. No, I don't want to think about it. I just want to move forward with life.
Being reflective, it's like taking a mirror and then you look back.
No, I don't want that. Like, excuse me, think about my thoughts. Okay, but it's a very good point that already said.
Yes,
you must
yes.
Think about what thinking about, who are you really, but we are scared to know ourselves. Okay, but anyway, but thank you. I think this was very informative.